Hello, 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 beautiful people. How are you? This is Ashley Nicole with The Practical Life, and I am back again today with another live. I am on a roll. I'm so excited because I've been kind of keeping with my goals for this week as far as going live. And today I have a video that's pretty, like, kind of, I would say, um, kind of like a foundational video when it comes to mental health and what you should expect when you are starting therapy or when you're going to that first therapy session. I did a shorter video, like a short um, about this, or I have a short about this on my channel, but I wanted to kind of do a longer video, excuse me, and have a discussion about and answer any questions and that you all may have about this particular topic. So I hope you all can hear me. I've been playing around with my audio and things like that, using a Bluetooth or using a specific particular speaker, but now I'm using my actual laptop speaker. So I want to see how this sounds. Guys, this is growth over here on, on YouTube. I really started this to kind of, have something, special on my own to do. And I wanted to have something, to kind of see it grow, wanted to do something like creatively for myself. So I'm starting from the bottom. Okay. I want to really see like the growth. And I think it's really, really fun just to kind of see something that started from this place and then now, it becomes something else. So I appreciate you all if you're watching the replay or if you're watching me live. Appreciate that you all are kind of sticking it out with me in the growth process. I'm kind of doing it like the old school way, right? Now, you see YouTubers that start, they got all of the works. They got the lighting right, they got the audio right. I'm just kind of experimenting and seeing, what things work, what things don't. And my whole purpose here is to share information with the Black community and make sure that we know about mental health, where our resources are, how to help each other, and talk about different things and have discussions related to mental health. Some people are not comfortable enough to start therapy or to, ask specific questions face to face. If you know someone that's a therapist or know where to find them, right? So here you can rest assured that you will be getting the play by play when it comes to that particular topic. And I'm gonna give you the real, I'm real, authentic person. And so, I really, really am passionate about this particular topic in my community. So I'm just here to help. So with that being said, again, my name is Ashley Nicole. I'm a licensed mental health counselor, and everything on my channel is related to either mental health or careers, because I also have a background in career coaching and career counseling. So I kind of help people navigate the workplace, and especially if you have been diagnosed with, or if you are having symptoms, maybe you haven't been diagnosed, but you're having symptoms of anxiety, depression, which are the most common in the workplace. I'm able to kind of help you manage those symptoms and manage your work through that. A lot of people don't know there are a lot of resources for people who experience mental health symptoms in the workplace, right? So if you need any consultation or any additional guidance, please leave the questions in the comments. If you're on the replay or if you're watching me live, you can put a question in the chat section and I'll see it. And I'll do my best to be able to answer it. But any additional information on how to contact me will be in the description box. So today, this might be a shorter live. Um, but I wanted to, and I always have my notes. I have to have notes because I'm all over the place when I start talking, and then I think of something else, and then I'm like, okay, I need to say this piece, and then I try to go back to it. So sometimes I might be all over the place. So that's why I have my notes. So if I look down, that's exactly what I'm doing. So y'all, please get me back on track if I am all over the place. But um I really, again, wanted to talk about what you should expect when you go to a therapy session, specifically the first therapy session. Now, even before that, as a therapist, I understand that a person has to really prepare themselves to schedule a therapy session. Like people don't realize, especially if you are having symptoms, it takes a lot to be able to get to the point where you call somebody to schedule an appointment. And believe it or not, there are a lot of therapists who haven't had therapy, which is really a kind of like a disservice to their clients, right? Because you're not going to know or empathize with your client if you haven't been in their shoes, right? And you can kind of understand what they're saying, but especially if they're coming to you for the first time, you really don't know what they may be thinking or feeling if you haven't even had a first therapy session, right? So I don't know if anybody knows this saying, but you always hear people say, like, whatever profession you're in, like that's what you need help with, if that makes any sense. So, and it's not true. I think it's just, a saying, of course, but it's not true for every profession because, like I said, for instance, if you're a lawyer, that doesn't mean that you've been in legal trouble. You know what I'm saying? Like that you're in trouble with the law. I mean, it could mean that, but maybe not. It probably not. It's a slim chance. Um, so it goes for therapists. Like every therapist needs to have a therapist, right? And I'm a firm believer in that. Now, you may not be in therapy for years at a time or months at a time, but I think that it is important to have the experience so that you can kind of relate to a client that is coming to you for the first time, right? You can think about what questions they might ask, what they may want to know, and that will allow you as allow therapists to be able to say, okay, these are the uh, answers that I may need to have for these particular questions. They may want to ask this, or if they don't, then you pose a question to them. Did you want to know about this? Or just give them the information because I think it's very important. So even before you schedule the session, you got to build up courage to be able to do that. Now, therapists typically in master's level programs, we practice sessions, right? But this is only practice. Um, you would have one of your a fellow student or whatever, you all will practice a particular session, and most likely this happens when you are kind of practicing different modalities like cognitive behavioral therapy or solution focused therapy. For those, for different modalities, they're based on the information that the client is letting you know, like what their issue is or what they're having challenges with. There are specific questions that you're going to ask them that fall in line with that particular modality. So most of the time, the most common modality would probably be cognitive behavioral therapy, where you're changing the behaviors and kind of changing the thoughts. In turn, that will change the action that you're doing, right? And then also solution focus. So with the type of society that we have set up, I find that that's what people are looking for. Nobody wants to stay in therapy months, weeks at a time, right? They want the quick fix. They want the quick fix. They want to, and this is solution focus, I find, is more for people who have maybe mild symptoms of anxiety, mild symptoms of depression, or like you don't necessarily have severe symptoms, but maybe there is a particular situation that you've gone through recently, and you're kind of having trouble coping with it, or something like that. Something for like an acute type of situation or some acute symptoms. Normally, you will probably use solution focused. Um, so yeah, so before you go to this session, you got to build up courage to be able to go, right? So during that time, you might be doing a little bit of research about therapy, or maybe the type of therapy that you want to receive. Or the most important thing that I recommend that you do is research whatever therapist you find. How will you find them? It could be through EAP, it could be through Google, it could be through word of mouth, um, it could be through calling 211, it could be through your insurance, right? Whomever you pick, do your due diligence to research them, right? Go to Google, find, maybe they have a website. Their website will tell you a lot about them, right? Maybe the history of their particular practice, or what type of modality they use, right? Maybe that particular therapist that you chose met your criteria for being culturally competent, or simply because, they were a Black therapist in your area and there aren't many in your area. However, when you go to their website, you see that their focus is trauma focused therapy, but you don't necessarily need that, right? So then you might say, okay, I'm going to find a different therapist with a different focus or something like that. So make sure that you kind of know what they particularly focus on, so you kind of get an idea if they may be the right therapist for you. So in doing that, okay, you find the therapist, you know who you're going to go to, right? And so you make that call. Now, keep in mind, guys, I mean, especially nowadays, therapists have face-to-face practice, and they also have virtual practice. Now, virtual practice is seeing someone, over the computer or whatever, right, in your area. Now, you may not primarily, that's the focus now because of the pandemic and things like that. So there are a lot of therapists who have face-to-face. People are coming back into the office now, but primarily they will do virtual counseling. Now, with that being said, you've got to keep in mind that because virtual counseling is a little bit more prevalent now, they may have more clients. So it may take them some time to get back to you. Say, for example, you found the perfect therapist in your mind. Like, you're like, okay, this is the person I want to go to. This is their focus. This is what I need. I want to try this person. You might not get a call back for like a week, or at the latest, I would say a week and a half. If somebody doesn't call you back after a week and a half, you might want to try to find somebody else. But typically, it might take a while to try to make that appointment or speak to them over the phone. So keep that in mind. Don't just count them out because they didn't call you back the same day. You know what I'm saying? They're probably with clients all day, or they just didn't get back to you. And I'm gonna let me know on the replay, or if you're watching me live, like, who wants to be a therapist. I have plenty of information on that, and I can kind of talk about a day in the life of a therapist and like what to expect and things like that. So don't get discouraged if they do not call you back the same day. So Moving forward, you get a call back, right? They say, oh, can you come this day? Now, say, for example, you're going face to face. Let's talk about that first. You're going face to face. This person is in your area. They are, have focus on what your challenges are. And so you're going to be going to see them. Now, you want to on the phone ask them, like, do they accept your insurance? You want to make sure that, and some of these questions they will ask you, but just kind of be prepared with your information, right? They're going to ask you, what insurance you have. You can ask them if they take your insurance. Do they take HSA card? Some people, pay with their healthcare card. You can pay for counseling sessions with your healthcare card. It's called a healthcare spending account. And a lot of employers, when you sign up for your insurance, have this option for you to be able to set aside a certain amount of money out of your paychecks to be able to put in a specific account. They'll send you like a card. It's like a Visa card. And when you get any medical service, you can pay for that service with that particular card instead of paying like with your regular debit card or credit card or whatever. And so you can pay for therapy sessions with that particular card. So you want to ask them, do they take HSA? And do they take, regular debit or credit cards? What is their preferred mode for payment? Now, there are some therapists who do super bills. You can kind of talk to your insurance company about that. They do super bills where they would, kind of send a bill to the insurance company, but you will want to talk to that therapist about that as well. So you set up your appointment. It's time to go to the appointment. It is normal that up until that appointment, up until the day of, up until the minute you walk into that door to see the therapist, you're going to be nervous. You're going to be thinking about, what are you going to say? How is the session going to be? Again, especially if this is your first session, what should I expect? Now, if you are, say for example, you live in a small town, everybody knows you. There aren't many therapists in your town. Like, this is one of the few. You may be wondering, like, is my information going to be confidential, right? Or is somebody going, whatever I talk about, is somebody going to find out this information? Or wondering how much you should share. These are real concerns. What I will tell you is that everything that you talk about with a licensed therapist is confidential unless you express harm to yourself, express harm to someone else. If there's any child neglect, abuse, elder abuse or neglect, any physical abuse, sex abuse, those things have to be reported because we are mandated reporters. And so you can rest assured that everything is confidential. Now, before you get to the appointment, the therapist may send you the forms that you need to fill out, right? Where, just basic information, just like you would at a regular doctor's office. You're going to sign confidentiality forms. You're going to sign HIPAA forms. You are going to sign, most likely, pretty much, I think, all therapists, unless they'll give it to you. If they don't send it to you beforehand, they'll give it to you once you get to the appointment. Say, for example, you want your mom to be able to obtain information about your care. You will have to fill out a form giving us permission to speak to your mom or speak to your spouse or family member or another service provider like your primary care doctor, or if you have a psychiatrist, for us to be able to provide information to them and discuss your treatment that we're providing with them, you have to give us permission to do that. So you're going to be filling out those forms either beforehand or when you get to the office. Now, if you don't want to share the information, you wouldn't fill out the form. So you don't have to, share information with your primary care doctor. Most likely, I find that that's very important if you do have like a psychiatrist, where you are being prescribed medication, or your PCP can prescribe medication for the mental health as well. But the psychiatrist specializes in medication for mental health. So if you are seeing one of those doctors and you are being prescribed medication, I think it, as a therapist, for me, is very important to kind of collaborate with them, because if you have been on medication for a long time for your condition, or they just prescribed it, right, it's important for me to speak with those doctors if needed. It doesn't mean that I will if needed, though, right? If there's an emergency, or if you come to session and I'm seeing very severe symptoms, you're expressing severe thoughts and things like that, and you indicated to me the week before that you were just prescribed a specific medication, then I may reach out to those doctors to say, hey, it was indicated that this person was prescribed this medication last week or a couple weeks ago, and when they came to session today, I noticed this type of behavior. So that may give that doctor some indication that this may be a side effect of that particular medication, and they may have to call you in as soon as possible to change the dosage or something like that. So don't be very mindful of that. Not even with therapists, but just with your regular doctor, make sure that you kind of think about who you want to share information with, because it could help you when it comes to your health. So yeah, so then you will fill those out. Now, when you get there, right, again, you're going to be nervous. You're going to be nervous. But the first session, guys, honestly, is the easiest session. The first session is the easiest session because you're just filling out paperwork. You're just filling out paperwork, right? And you can provide any information you want, but the therapist is going to ask you questions. So for me, I can only speak for me, right? What I normally do is, and keep in mind, every therapist is different. Every therapist is different. They have their own way of doing things, but for all of us, the end result is to make sure that you get better, right? To make sure that you're able to manage the symptoms that you're having, things of that nature. And keep in mind, too, that the first therapist that you go to doesn't have to be your therapist. Like, you could see them for that session and say, you could leave a session and you're like, I don't know. I feel like I want to try somebody else. Feel free. Like, this is your life. You know yourself better than anybody. Your therapist is not there to give you the answer to anything. We are there to guide you, right? And kind of guide you in a way where you are now empowered and enabled to become a little bit more self-aware of your situation, and you ultimately make the decision about what you need to do and whatever challenges you're having in what situation that you're in. So I asked a lot of questions. I want to know, after you fill out all that paperwork, I want to know what brought you here. Why now? Right? You've had been in a situation for 10 years, right? Or maybe you've been thinking about going to therapy for 15 years. Why are you coming now? Like, what triggered you to say, you know what? I'm going to make an appointment and I'm going to keep the appointment and I'm going to go. What made you walk in this door and sit on my couch? So I asked, what brought you here, And so, in talking about that and getting the answer to that, that's when I find most clients kind of start giving information about what's happening, what they've been feeling, what they're experiencing, if they think they have anxiety or depression. It's so funny because people are quick to label themselves. That they really are, instead of just kind of looking at the situation like, okay, this is just life happening. Um, doesn't mean that it's always going to be that way, but I find that people put labels on themselves and they will quickly say, oh, I have anxiety, even though they haven't been diagnosed with anxiety by their doctor or by a psychiatrist or PCP or anything like that, and have never had therapy before. Because we do diagnose, we just don't prescribe medication for the mental health. So people are quick to say, oh, I have anxiety, or yeah, I have depression. And you might have those thoughts, but it doesn't mean that you're in that state, right? So we have to be careful about the words that we use and how we use them, because you could be labeling yourself, and in turn, labeling yourself will kind of make you get in that mode for real, if that makes any sense. So, what brought you in? And the important one that I always ask is, what do you expect to gain from therapy? Like, are you looking for somebody to give you the answers? Because if so, sis, bro, I'm not the one. Like, I can't give you the answers. I'm not in your shoes. I don't live your life every day. Only you know what is best for you. So if you're looking for somebody to give you the answers, therapy is not for you. um so what do you expect to gain? Are you looking to gain a different perspective about something, about a situation? Maybe you're going through something at work, and it's really kind of shook you a little bit, and you're like, maybe it's just me. Maybe it's just me, and you want to get like a unbiased opinion or perspective, about something. Is that it? Um, or are you really trying to get better? Like, do you really want to change your thought process? Do you want to be more optimistic about life? Do you want to understand yourself more? So these are kind of questions that you can kind of think about. I'm giving this to you all so you can kind of think about it beforehand, just in case, that there was actually like, what do you really want? And also for yourself, just think about it like, am I going to therapy because everybody says you should go to therapy and all this? Or do you really, like, are you really ready to do the work? Because I will tell you, therapy is work. And for the people, most times, I'm not going to say all the time, but most times, for the people who want the quick fix and y'all who want that solution focused therapy, like, you know, my girlfriend broke up with me, my boyfriend broke up with me. Okay. Like, for some people, it's very difficult. Don't get me wrong. For some people, it is so difficult to go through a breakup, and they need effective coping skills to be able to get through it. But there are a lot of people who are just like, yeah, they broke up with me. What am I supposed to do? But then they don't want to do the work. They don't really want to do the work. They're not to a point where they can take accountability for the part that they played. So those are the people that you find that may come to therapy a few times. And when you start asking the hard questions to make them really think about what's really going on or how they got to that point, baby, they out. They out. They like, I'm out. I'm out. I wasn't ready for all of that. I know you're getting ready to ask me all these hard questions. Um, I'll holler at you later. So that's typically what I see. But right, so what do you want to gain from therapy? So then I will ask questions about your work. I'm really like passionate about those two areas, your mental health and work, because I know mental health affects everyday work. It's stressful going into work, having a job. um if you particularly are a leader or a manager, it can be very stressful. It could take a toll on you. It could take a toll on your family. So those two areas I really like to get a lot of information about. So I ask you, how are things going at work? Tell me about your work. Um, if you guys didn't know or notice, therapists ask a lot of open-ended questions because it allows us to get more information that will be able to kind of help us guide you in a particular manner and becoming more self-aware. So I will ask, tell me about work. What do you do for work? How would you describe your work environment? Do you work from home? How has remote work been for you? Those type of things. I'll ask you about your family. Describe your family for me. Now, sometimes depending on what you came in for, I won't ask like questions about like how you grew up. I might. It just depends. It just depends on the way the conversation is going, um, or interview per se, kind of, because I'm asking you questions. You can kind of look at it that way. But you want to be, of course, you want to be like truthful and authentic, and really, this is your time to like take care of yourself. It's really a form of self-care. Everything that you've never said or felt about things that you have experienced, this is the time to do that, right? So I asked you about your family. How would you describe your relationship with your parents, like those types of things, depending on the reason why you came in. I also ask you about your hobbies. Like, what do you like to do? This tells me, if you have an outlet, if you have a particular passion for something, right? Because those things could help in the long run while you're going through the process of therapy, right? If you particularly at a certain point you get stuck, that will is a reminder like, okay, you're stuck, you're having a rough day. Remember, you like to do this, you're passionate about this. Why don't you try to engage in this particular activity that you love, right? So I ask you about your hobbies. I ask you about your future plans. Do you have any future plans with your career? Do you have any future plans regarding family? Like in 2, 5, 10 years, what do you envision your life being like or looking like? And then I'll ask you about relationships. Are you married? Are you not? Are you in a serious relationship? Are you in a long term relationship? Are you in a long distance relationship? Like, those are the type of questions that I will ask, and the type of things that we will kind of get background, it's like background information about in that first session. And then also, you may notice that there is, just like I do here on the live, looking down, because we taking notes. We can't be remembering. Y'all don't understand. Y'all don't get it. Y'all don't understand. Therapists, some people will come and give their whole life story. Some people are a little bit more quiet, a little bit more reserved. They trying to fill the therapist out, like, do I really want to tell this lady all of this stuff, right? But some people, baby, they don't care. They say, this is my time. This is self-care. I'm ready. I was courageous enough. I'm to that point where I made the appointment and I'm coming in and I'm gonna tell it all. I'm gonna tell it all, and this lady gonna tell me what I need to do. So we taking notes. because we can't remember all this mess. We can't remember what happened to you when you was 5, and then at 15 something happened, and then at 16 and a half such and such did this, and then at 18 you felt this way about what happened when you was 5. I can't remember. I'm going to take notes. So but most therapists, if they do take notes, if they're note takers, they're going to tell you. They're going to say, hey, do you mind if I take notes? And so that we can kind of know what's going on and refresh our memory because we just can't remember everything. Also, a lot of clients don't do this, but I encourage you to take your own notes. Take a little notebook with you, like, something, or take notes on your phone while you're there, about maybe different things the therapist asks you that you really never thought about. And you can kind of, after the session, kind of think about those things on your own or journal about it, or whatever you need to do. Is maybe certain things that the therapist will ask you and you're like, I never thought about that, or I never considered that, or asked myself that question, because it will kind of get you to a place where you start to become aware of different things, and you can you know kind of sit with it yourself after the session. So take notes about if you feel like this therapist is right for you, right? Even if you maybe don't take the notes while you're right there, right, answering the questions, you can take those notes after when you get in the car, just so you don't forget. Because maybe you feel like, oh, I don't really want to come to this person again. But if you go to the next therapist, right, you can kind of look back at your notes and say, okay, this is the reason why I wasn't feeling this therapist so much. And so I'm going to kind of look for those things or be aware of those things when I go to the next person, and see if they kind of display that same type of, demeanor or attitude, or the way that they ask questions, whatever it might be. You can kind of, so that you can, weed out certain people, or make note of, okay, this is the person that I want to stick with for right now. Um, Also, again, it's not as scary as you all think, especially once you get past that first session. Like, guys, it is the easiest thing in the world, right? Most people love to talk about themselves. They do. It's just human nature. People want to tell you about their accomplishments, you know, um, about their family and what their family has done, what they have done, what they plan to do. People like to talk about themselves. They love to give you the elevator speech, right? And so if you're one of those people, this is your time to have a third party really give you some help you to gain some insight into what you've been experiencing, and it helps you become aware of, if you've gone through a particular situation, or maybe something happened at work, for example, you start to see like, okay, it's really not that big of a deal like I thought it was. Or, you know what, it's really not about me, it's about what that person was going through that day, you know, or I didn't get that job. I didn't, I did well in the interview, and but I still didn't get the job. You know what? Maybe it just wasn't for me. There's nothing that I did wrong. Maybe it just wasn't for me. So let me see what I can do next time. So you kind of get that third party, um, not advice, but just third party perspective, or their vantage point about what's happening. Because a lot of times, as people, what we think is happening is not really happening, if that makes any sense. Like, what what I want y'all to get from this live is that feelings are not facts. And I had to realize that too. What I'm feeling is not factual all the time. Feelings are not facts, y'all. And so it may take for you to go to therapy to realize that, or regarding whatever situation you in, because everybody's life is different. But feelings are not facts. And everything that happens, it doesn't, it may not, it's not happening to you. You see what I'm saying? It's not happening to you. It may be happening for you, right, to get to a certain point, but it may not be happening to you. But what you feel about certain things may not be factual. So therapy is a great place to go, right? And it's not like it's not a huge commitment per se, because again, you can shop around. We encourage you, find the right therapist for you. Because you go to this one person this week or 2 weeks or 3 weeks, it does not mean that you have to stay with them for 6 months. It doesn't mean you have to stay with that therapist for the whole year. And therapy is also a place where you practice those certain skills or specific skills that you may not be comfortable with. So say, I'll give you an example. So say for example, I had a client or whatever, and they weren't really comfortable with me, right? They may not be and this is just, you know, an example that I'm giving. Maybe they're not comfortable with me, right? Maybe they feel like I'm not the right therapist for them. Maybe they feel like they could stay in therapy with me, but in one particular session, I said something that rubbed them the wrong way, or I asked a question they weren't ready for, and they didn't say anything about it. Well, in learning coping skills and learning how to effectively communicate in therapy, right? Maybe that's one of your goals. So this is the time to practice with that therapist. Hey, I really wanted to address something with you. You said this, and I felt this way. I feel this, or I felt this when you said this, or I felt this when you did this, or, so it's kind of, sometimes depending on the situation, you can practice those skills and the therapist will give you feedback, right? About, how you're doing with your particular goals, because you will also, probably not the first session, because you're gathering information, therapist is gathering information, you're kind of gauging if you want to stay or come back the next week, right? That you will go through, what you want your goals to be, and you'll come up with a particular plan and objectives for those goals, because again, you're just not there to just be talking. You want to get some things done. You want to meet some of your goals and try to come up with a plan. And throughout the time that you're with that therapist, you're going to be gauging how you're doing with those goals. Are you meeting those objectives? You're going to be doing check-ins if you have, the right therapist, because just like in every profession, you have some people who are slack, to be honest. Just lack of better words, they slack. And so they may not be doing check-ins with you. And it could be reasons for that, various things, right? But they should be checking in with your goals, as well as how you're feeling as far as them being your therapist. So I do check-ins as well. I say, hey, at that first session at the end, how do you feel this session went? Are you comfortable with making another appointment? You got to gauge that, because if not, it's really honestly a waste of time for you. If you're just going to someone and you're not comfortable with them, or if you're not sure, don't stay. Find someone else, shop around. And you might shop around and you say, oh, I don't know about this one. Maybe I'll go back to the other one, right? Maybe I'll go back to the one I went to previously. So, it could be a number of things, but again, you can shop around. So I challenge you all to make an appointment. Make an appointment with the therapist, even if it's a virtual appointment. You can speak to a therapist through your EAP. If you have EAP, an employee assistance program, they are available 24/7. So you can speak to someone on the phone. You don't even have to see them. They don't have, if you're not there yet or you're comfortable with seeing someone on the camera, by the computer, or face to face, you can speak to a therapist through your employee assistance program and let them know what's happening, what you need help with, so on and so forth. And they are going to essentially do the same thing the therapist would do face to face or on a virtual counseling session. So keep that in mind as well. That's another resource for you all. If you all need resources on how to find a therapist in your area, please let me know. Even if you need to reach out to me individually, I'll be glad to help you all with that. Again, all of the information on how to contact me for any consultations will be in my description box. But I am going to go ahead and get out of here. Thank you all for listening. I hope you found this information helpful and I hope you enjoyed this live. Again, let me know on the replay in the comments if if you want to share, you don't have to share, but if you want to share, how was it at your first therapy session? Like, was it as nerve wracking as you thought it was going to be? Or was it like easy peasy, right? Again, depending on each person's situation. But I'm so glad that you all are here listening. If you're watching me live or on the replay, I appreciate you all. And I hope to see you all in the next one. And I hope you have a wonderful rest of your day. Until the next time, bye.